Welcome today to the NHCC Educational Committee Roundtable Forum on Cannabis 101, where we bring medical professionals together to demystify the health and wellness power of cannabis to break down the Latinx community's long-held cultural taboos and beliefs on cannabis. My name is David Sanchez, board member of the National Hispanic Cannabis Council, and also Cresco Labs VP of Product Development. Today, we are here with our two other NHCC Board of Directors, Dr. Phil Burns and Dr. Craig Ontel from New York State of Mind. And I'm your host, David Sanchez. I've been in the cannabis industry for a decade plus. I started in the Colorado scene. That's kind of where I was born and raised, or just raised, excuse me. And I did my studies at the University of Colorado Boulder, specializing in chemistry and biochemistry. From there, I got a really good passion for cannabis and where the cannabis industry was headed. And so I doubled down and dove right in. You know, I spent some time in California doing a lot of work with recreational companies. And about 4 years ago, I got the opportunity to switch over to Cresco Labs. And that gave me the opportunity to not only do the recreational side of cannabis, but also the medical part. And that's what has really helped me continue my drive for the plant and my passion for the industry. Today, I'm here with Craig, who trained at NYU Rusk Institute of Rehabilitation. From there, Craig has spent nearly 15 years of private practice in NYC. Craig also served as the director of ambulatory orthopedic rehabilitation hospital at NYU Langone. In May of 2021, Craig actually left NYU to become the CEO of State of Mind Cannabis. Also with us is Dr. Phil Burns, doctor of osteopathic medicine. He's been practicing medicine for over 20 years, completing specialty training in the field of physical medicine and rehabilitation at NYU Langone's Health Rusk Institute of Rehabilitation Medicine. Upon completion of this training, he founded and has operated a successful medical practice based on a patient's first principle. In private practice, he specializes in orthopedic rehabilitation and prosthetics. He's participated in academic rounds on the neurologic rehabilitation service for many years as an assistant clinical professor at NYU Langone's Health. Dr. Burns is driven by his desire to make a meaningful impact in the state's opioid crisis. So thank you guys for joining us today. We have a really good show for everyone today. So thanks for joining.
Thank you for having us.
Of course. For today's show, we really wanted to talk about cannabis and how it relates to cancer. I think this is a very interesting topic that a lot of folks often bring up. As an introduction, I thought we could start with a little bit of the endocannabinoid system and homeostasis, how that relates. And I think that'll really tee up the conversation and we'll incorporate kind of how that correlates to cancer. So do you guys want to take it away on the endocannabinoid system and homeostasis?
Sure. And, thank you for the introduction. And cancer is a very broad topic. It's multifactorial. And as we were preparing for this talk, it really rang true how it mirrors, in a way, how we discuss the endocannabinoid system. What happens in cancer is we have a collection of uncontrollable reproducing cells. And instead of their following their pre-programmed instructions, they're acting on their own in an aberrant manner. Thus, their homeostasis is off. This can be caused by a multitude of factors: radiation, environmental, tobacco, smoking, etc. Regardless of the cause, the outcome is really the same. It's cells that are reproducing uncontrollably, not in the manner they're supposed to. With an endocannabinoid deficiency, we see multiple systems in the body operating also in an uncontrollable manner. Cancer is very difficult to treat because it involves multiple systems throughout the body. The endocannabinoid system addresses multiple systems throughout the body.
Interesting. That's actually a really good way of speaking to that. And the uncontrollable manner, I think, really helps to explain why some of these physiological processes are out of balance. And so, how do we think that cannabis can help, or how can we begin to talk about that?
Well, really, when we take a look at the highest level here, and we go back to the endocannabinoid system and the endocannabinoid deficiency that people run into, and we take a look at cancer, we do see some parallels here. And going back once again to that homeostasis phase, we need to get the body in order again. And what's happening, especially with cancer treatment, is unfortunately sometimes the cure is worse than the disease. We say that in medicine. And a lot of the traditional treatments for cancer are actually poison at the same time. And they cause harm at the same time that they're causing good. And they help those medications knock us further out of homeostasis. So by using cannabis, we're able to level that playing field again. However, the research we're really just scratching the surface of research with regards to cancer and endocannabinoids.
Craig, you mentioned sometimes the cure for cancer can sometimes often cause more harm. And I think sometimes bringing these types of solution to patients, there might be some hesitancy. But what do you think some of these hesitancies are as it relates to the cultural taboos of cannabis? And how do you begin those conversations with those folks?
That's a great question, David. And that's something that Dr. Burns and myself and other cannabis providers run into every day of the week. And there really are these cultural stop, and there's a lot of taboos around cannabis. And it really all comes down to education. And that's where we feel we do the best job. And in these specific doctor patient or pharmacist patient or medical dispensary patient interactions, it's really the education and breaking down those barriers. And it's unfortunate because the trust is with the physician as it should be, but unfortunately, the cure we give people is not helping them. And for an example, we use a lot of opioids to treat cancer pain. That creates its own series of problems. You have addiction and you have tolerance, so you have to keep raising the dose. And then you have secondary problems such as constipation, nausea, fatigue. So the cure, or what we're giving someone to help them, makes them feel much worse. There are a lot of studies out there which look at chronic pain, cancer treatment, and they really do make a comparison between the benefit of opioids versus cannabis. And in an aggregate, when we follow up with folks, at least 60% of them are sticking on their cannabis for pain control and prefer it as opposed to opioids. And it's not only for the immediate symptom, it's also for the entire quality of life. So when we sit down and we go through these cultural taboos and barriers, we approach it from a quality of life perspective. And we involve the entire family. And we let them know that what we're doing here with cannabinoids is a safer alternative, short-term and long-term.
That's awesome. Thank you for walking us through that. One question that I was thinking of as you talked about that was, is there an easier approach because this is a plant and it's kind of coming from organic means as opposed to the synthetic route? And you mentioned education as a big pillar of starting these conversations. Is that a good segue into talking about the actual plant and what that overview looks like?
It is, and it's actually a very easy conversation we have, because everyone who's watching this today or tomorrow, whenever they see it, the reality is they don't want to take another pill.
Yeah.
When we see people in our office, what do doctors do? We give you another pill. You come in, you got a problem, here's another pill. At the end of the day, you got 20 pills, you're not taking them. We also know in medicine, the more pills someone's supposed to take a day, the less likely they are to take them. And people want a natural alternative. There's a reason why Whole Foods is busy. It didn't exist a few decades ago. So the consumer themselves are looking for something that's natural and something that works. If we peel off the layers of the onion here, we've been using cannabis for hundreds, if not thousands of years in the medical community to treat ailments. And it wasn't until the 20th century that we became so anti-cannabis in this country and elsewhere. It's a plant, it's a natural plant, it grows pretty much everywhere. And as a medicine, it's been safely used for an incredibly long time with pretty much no side effects.
Yeah, I think when we talk about the use of cannabis as well, it's nice to include the fact that it can address several different side effects of cancer, as well as the cancer treatments, including nausea, vomiting, abdominal distress, loss of appetite, pain, so even sleep and wellness. So we're giving one medicine, cannabis, to affect many different side effects of both the cancer and the cancer treatment.
And that's a great point, Dr. Burns. And you're right. And the reason why we're able to accomplish this goes back to how we started this conversation about endocannabinoids and endocannabinoid deficiency. And Dr. Burns has done a lot of work on this, but there are all these minor breakdown products, terpenes and flavonoids, and they all do something different. And when a patient uses cannabis in the inhalation form, meaning they're smoking it, those 100+ different products of cannabis all get exposed at once. And as science moves forward and we know what each and every one does individually, we'll really be able to customize things along the way. But Dr. Burns, you're 100% correct. By using cannabis, we're hitting multiple problems in that patient at the same time with one product.
That's amazing. And, Phil, you touched on the efficacy of this medicine and having it able to target multiple kind of processes. And Craig mentioned, the more pills and the more kind of medicine that we prescribe, the less likely it is for someone to really take that. When you transition somebody over to a cannabis approach, how in terms, like in a simple kind of statement, how quickly can they cut off those other medicines, or what does that look like?
Well, it's a process, and sort of the start low, go slow adage applies, where we build people up to a tolerable level where we're getting symptom reduction.
And Craig also mentioned, you often find yourself prescribing an opioid, increasing the concentration, increasing the frequency of the medicine. Do you see that same kind of trend with cannabis?
No, we don't. We really don't. It's I've been a medical cannabis provider for a handful of years and one of the busier doctors in Manhattan with it. And I have the luxury of renewing my cannabis prescriptions annually for New York State. And there's rarely an uptick in dosing ever. If anything, I'm happy to say that my patients who were using a higher THC concentration have kind of leveled down more to an even THC CBD ratio. So I'm actually seeing the opposite in the medical community.
That's outstanding. That's amazing to hear that.
And also, if you look at the statistical data on cancer patients and chronic pain patients, cannabis use decreases opioid use. We just see that historically across the board. So as we transition folks to cannabis, their opioid use is dropping.
I'm sure pharma doesn't like that.
No. And as we go and successfully treat and have higher survivability with cancer treatments, to start someone on an opioid and risk developing an addiction when they're likely going to survive their cancer, heal and improve. We don't want to then have to treat an opioid addiction after the fact.
Yeah, and I think you, both of you doctors mentioned the addiction piece of opioids, and I think in the Latin culture and community, I think oftentimes the addiction towards marijuana is top of mind. How do you guys speak to those kind of questions, and do you get those questions? Am I going to become addicted to this new medicine that you're proposing?
In the Latinx community, it's, it takes a while to even get to that question. As soon as I mention cannabis, it's whoa, usually, depending upon the age demographic of the patient. And I understand that where I'm 53, folks my demographic and a little bit older that haven't used cannabis, they see, some younger kids in the street using it for a different purpose. And that's all they really see. However, when we take a step back and we speak with them and we show them that they're in the office because the opioids aren't working, or the side effects of the opioids aren't tolerable anymore, or they can't even get the opioids because the physician doesn't want to write them or the pharmacy doesn't want to fill them anymore, then they start to realize that, this is likely a safer alternative. We walk them through the data and we really reinforce that it's not a gateway drug and it's not something you're going to move forward to above other medications, and you could stop anytime you want. And once we get them to just try the product, the very low THC, where it's not going to affect them cognitively, invariably, they're fine using the product moving forward. But we need to be careful on our physician end to make sure that we don't, open quotes, get that patient high, because that's not what they're looking for. Yeah. And if we do that, we have lost that patient right there.
Wow, that's powerful. And something else that I wanted to open the conversation to is you started off with saying cancer is a very broad topic. Let's narrow some of that down. What specific types of cancers do we see the best efficacy with cannabis? Are some more treatable? Are some less treatable? Are they all similar in the types of efficacy that we can expect? Help us understand that.
I think the most important thing, and Phil, chime in at any time, for us to really realize is cannabis is not curing cancer. And there's a lot of misconceptions out there that it's curing cancer. All the research we have right now is pretty much animal-based, primarily mice. We do see some positive things, but we're not curing cancer with cannabis. We're helping the symptoms and the side effects of the cancer, as well as the treatment we're giving people. So the cannabis really is giving folks back their quality of life, whether it's from an anxiety component, a pain component, a GI, meaning a stomach component, fatigue. That's what the cannabis is doing here. Now, with that said, it's not like I'm here to be a downer of the day. We are doing a lot of research, and at Temple University in Pennsylvania specifically has just come out with a CBD analog, meaning a breakdown of CBD, and it's a big name, but I'll say it, KLS 13019. You don't have to memorize it, But what that does and what we see in studies is it's helping with nerve pain secondary to cancer treatment. And it's also helping to prevent the onset of the nerve damage. So we're working towards specifically treating symptoms. We're getting there, albeit slow, but we're focused on symptom modification now, as opposed to disease eradication. And the biggest reason for that is research and data. That's what it comes down to. And cannabis is still a Scheduled I drug. So for folks who are watching this that don't know what that means, in the eyes of the federal government, cannabis is the same as heroin. I'm not kidding. And we know it's not. And since it's viewed as such, there is no or very minimal research going on in this country. So a lot of the research is coming from overseas, Uruguay, Spain, Israel, where the United States is number one in our in-the-box medical research. We're at the bottom of the list with regards to cannabis research.
Wow. When you say it like that, it sure puts it into perspective. And hopefully we'll begin to start seeing, I don't know if looser regulations is the right word, but I think an increase in pathways, in clear pathways for conducting some of this research. It's amazing to see you looking at the Temple University work. Cresco Labs definitely has a good tie in there. We're very excited about that clinical registrant license and are eager to start exploring some of those studies. One question that I have is, what kind of research can we expect in the field of cancer and cannabis, and what would you say is needed?
So right now we have a lot of sort of patient response data, where patients that have been treated with cancer, patients with cancer that have been treated with cannabis for their associated side effects, what their response to it was, and what their compliance going forward and staying on the cannabis. So they've aggregated much of that information, and that has been giving us the sort of the background of where to go and where to focus. So additional research will be done with that sort of backdrop.
And the way I view it is the research should really be focused at, much like Phil said, what the subjective complaints are, because we want to get the objective problem fixed. But what our patients are looking for today is the data is not all that robust yet, is they're looking for help and they're looking for subjective relief. And that's what they're complaining about. So we're talking about their sleep, their pain, their nausea, their depression, their anxiety. That's where a lot of the research is and will be focused. It's going to take more granular data, like we said before we really make a lot of big scientific jumps.
And you also touched on the classification of it being a Schedule I drug. What kind of options are we left with, right? I think often people say, okay, it is Schedule I drug. There is some research happening. What are some of the challenges that folks in the research field are having? Access is one that I could think of. What are some of the other challenges that they're up against?
It's a funding issue as well. And, a lot of these institutions run the risk of losing their federal funding if they participate in cannabis research. And you really have to take a step back and decide if it's worth it for you or not. So we'll probably see a lot of stuff coming from overseas. I know we will. And we'll see a lot of private research. What it's going to take to make the difference is us. So the American public already wants it. If you look at polling numbers, it's above 60% are in support of cannabis. So it's not as if folks aren't asking for it. And the American Cancer Society, open quote, supports the need for more scientific research on it. All of the major medical societies do. However, we don't act as one, we're not one voice. We're
Yeah.
a lot of different voices, and we need to get together as one voice.
One plant, one team, one love.
Yes.
That's amazing. Okay. Well, what else can we ask about cancer, and how can we help educate the Latinx community on some of these topics? I think some of what you guys have already discussed is very powerful to hear, and very insightful. You know, I think you guys really touched on we should maybe not move away, but focus less on disease eradication and more of the symptom relief. And I couldn't agree more. I think people often need more help getting to sleep, more help being able to rest, et cetera, et cetera. Do you think a specific kind of symptom is important to target, or are we trying to cast a wide net here?
I think it's the all the symptoms, the cluster, and how it affects the individual, from lack of sleep, like you mentioned, decreasing pain tolerance, the increased pain level, the GI distress, poor appetite, leads to general wasting, and all of that together serves many different, or leads to many different negative aspects when it comes to dealing with cancer, right? Everything from the body's inability to continue with its fight, but also the patient's inability to continue with maintaining the treatment protocols and staying on the chemotherapy through the end, or tolerating the radiation therapy. So decreasing these cluster of symptoms do not just make it more tolerable for the patient, but also allows them to participate in the proven protocols towards eradicating the cancer.
Do we often see the patient not being able to finish treatment, or opting out of the treatment? I guess I'm unfamiliar with what that process looks like and what the completion rate is.
Oftentimes, patients have to either decrease the dosage of the chemo that they're able to accept, or shorten the course and not complete the traditional protocols for their specific form and stage of cancer.
Wow, that's heavy. One question that also comes to mind, you know, you guys mentioned a lot of this information is going to come overseas, right? And so one thing that comes to mind is GW Pharma's Marinol. How will we see that come to the States? Is that something that we have access to? Is that something that your patients ask for? What are your guys' thoughts there?
I'll go, because everyone will beat me up for it anyway. I don't mind. I haven't seen any of my patients do well with Marinol or any of those other pills. I haven't. And it goes back to what I mentioned before. Well, I didn't say the word earlier, but the word is decarboxylation. And when we look at this plant, the one plant, there's over 540 different chemical substances that are in it. And they get released magically by something called decarboxylation, which is a fancy word for heating it up. And that's how all of those properties come out. And we don't know what all of them do. Now, forget about that, and let's just go to a pill form now, where we take just THC and some other components, but certainly not 540. Someone takes this in a pill form, the THC releases, but you know, we're not 100% sure if it was the other 522 things that made the difference. Got it?
Yeah.
And that's where those fall short. You don't get that broad exposure to everything in the plant. And we're learning what these different terpenes and flavonoids and all these minor parts do. You know, for example, for nausea, for vomiting, for anxiety, limonene works great. For sleep, carboxyphenylene. I'm just giving you different examples.
Sure.
So as we learn more of this and we become better at plant manipulation, we will be able to get where we need to be. But the data just isn't there yet.
That's amazing. Yeah, I mean, I think everything that I've read on, patient experience and their time using Marinol or being prescribed Marinol is not positive. It's over concentrated. I think I read reports of people just over the top, even participants that had experience using cannabis thought that it was too much. And so it's interesting to hear some of your feedback as well. And also I think would you call that the need for full spectrum and the need for a holistic plant approach?
Yes, I would. Yeah, Phil, do you want to talk about that?
Yeah, I think it's the concept
earlier.
Yeah, I think it's the concept of the whole plant, that you're not just getting sort of a CBD or a THC component and the ratio between the two, but you're also getting all of the terpene profiles and flavonoids. And if you can think of sort of THC and CBD as sort of like the macronutrients in food, right? Protein, carbohydrates, and fat, all of these other things are all the vitamins, minerals, and all the other necessary components that gives you the big picture and a more complete palette.
Interesting. Yeah, sometimes I think THC and CBD steal the show, if you will.
Yes,
and I think oftentimes any real full spectrum oil or flower has CBG, it has CBC, it has CBN, right? And then it has the increased levels of THC or CBD. What do you guys think about going back to the research, right? If we can't study THC because of its classification and how it's scheduled, will we see more interest in these minor cannabinoids? And what do we know about them already?
There's going to be a lot of work in the minor cannabinoids. That's what's coming next down the pipe. And, I mentioned a few of the terpenes before, but literally there's hundreds. And like I said, we really are not sure what a lot of them do yet, because we haven't had that experience in researching them. But, medicine is very specific and it's very objective. And this is a medicine and it will be treated as such. It is now, but it'll be more treated as such. So what we're experiencing today is the blanket approach to treatment, where, someone comes in and to the dispensary and they say they can't sleep. And someone's like, okay, use something high, use a indica strain, but they're not getting any deeper than that.
Right.
And that's where all those minor components come in. And David, I know as you're sitting here doing what you do for a living, you would love to be able to say, hey, this product here has all these bells and whistles in it that you need on that flavonoid and terpene profile to get where you're going. And everyone on this call knows that that's what we're pushing towards here.
Absolutely.
And we'll get there. We will. Which is why we're smiling, because we all know we're going to make the right difference.
It's just a matter of time. Just a matter
of time. It's time. That's all.
That's awesome. Well, I think we've had a very positive discussion and very insightful so far. One of the things that I wanted to wrap up our conversation with was the overall patient response and how folks are responding to some of these treatments. Dr. Phil Burns, do you want to touch on the overall patient response and what we're seeing?
Well, self-reporting surveys of patients reported that cannabis as a substitute for other drugs was a safer alternative, had fewer side effects, and better symptom management, with also fewer withdrawal symptoms. And I think that, another thing that's important to mention is that the researchers interviewed patients at 1 month and 6 month follow-ups for changes of symptom intensity, physiologic and cognitive side effects, as well as quality of life, and overall the general effect of the cannabis. And they were surprised to see that 70% of the patients were still on cannabis, and 66 reported overall improvement of their symptoms. So I hope all of this gives patients a sort of information to go forward with their own doctors and their own healthcare providers. Be advocates for their care, ask engaging questions, and hopefully do better overall and have a better outcome when it comes to cancer and their cancer treatments.
That's amazing. Craig, any closing thoughts?
No, I mean, I think we touched on a whole bunch of really important topics here. And, you know, I think Dr. Burns really just summed it up properly. The reality is patients are feeling better. Patients are using less opioids. They have a better quality of life, and they're continuing to use the product even 6 months out. So we know as healthcare providers here, we've tapped into something. It's working. We just need to have the additional research and support to get us to the finish line.
Thank you guys so much for your time today. And thank you to the NHCC for bringing their mission to the forefront of the conversations, where we're bringing, you know, the information to really drive the health and wellness of the cannabis plant and try and give that information to the communities. So thank you guys once again. It's been an honor having this conversation. Make it a great one.